Hi everyone, welcome to Group 6 presentation. My name is Adriana Corral and my presentation partner is Lindsay Davis. During this presentation, we will be talking about experimental and quasi-experimental design. What is an experimental design? An experiment is a type of research method in which you manipulate one or more independent variables and measure their effect on one or more dependent variables. Experimental design are important for determining cause and effect relationship between dependent variable and independent variable. An experimental method is the only research method that can identify cause and effect relationships. Experimental design means creating a set of procedures to test a hypothesis. In our experimental method, we have two different types of variables. The first one is independent variable, a factor or condition that is deliberately manipulated to determine whether it causes any change in another behavior or condition. Our dependent variable is a factor or condition that we are going to measure at the end of our experiment. So we will purposely do something to our independent variable to see what effect it will have on our dependent variable. Identifying the independent variable and dependent variable. Let's look at some examples. Scores on tests improve with time spent studying. Our independent variable would be the time spent studying, and our dependent variable is the score on the test. Another example. What effect does caffeine have on memory? Our independent variable is caffeine, and our dependent variable would be memory. We have two different groups within the experimental method. The first is the experimental group. This is the group that is exposed to the independent variable, so they receive the treatment. And our control group is the group that is exposed to all the other same experimental environment, but they are not given the treatment. The only difference between our experimental and our control group is that our experimental group gets the treatment, or the independent variable, and the control group does not. Types of experimental designs. There are two basic types of research designs that we will be covering. True experiments, quasi-experiments. The purpose of both is to examine the cause of certain phenomena. It is important to know the difference between the two as people tend to confuse the two. Quasi-experiment and true experiment. Let me start by explaining what quasi-experiment is. A quasi-experiment is an empirical interventional study used to estimate the causal impact of intervention on target population without random assignment. So, in this experiment, the participants in a study are not randomly assigned to experimental groups. Contrary to quasi-experiment, in a true experiment, participants are randomly assigned to the experimental groups. True experiment is the preferred method because all important factors that might affect the phenomena of interest are completely controlled. Often, however, it is not possible or practical to control all the key factors, so it becomes necessary to implement a quasi-experimental research design.
There are certain criteria that must be met in a true experiment. One is that there must be at least one control group and one experimental group. Another criteria is that there must be a researcher manipulated variable. And the last criteria is randomization, also known as random assignment. We are going to go over some types of true experimental study. One is post-test only design. Another one is pre-test, post-test design. And lastly, Solomon 4 group design. So we are going to dig a little bit into post-test only design. So this design has two randomly assigned groups, an experimental group and a control group. Neither group is pre-tested before the implementation of the treatment. The treatment is applied to the experimental group and the post-test is carried out on both groups to assess the effect of the treatment or manipulation. This type of design is common when it is not possible to pre-test the subjects. Pre-test, post-test design. So in regards to this type of design, the subjects are again randomly assigned to either the experimental or the control group. Both groups are pre-tested for the independent variable. The experimental group receives the treatment and both groups are post-tested to examine the effects of manipulating the independent variable on the dependent variable. So lastly, we are going to cover the Solomon 4 group design. So in regards to this design, subjects are randomly assigned into one of 4 groups. There are 2 experimental groups and 2 control groups. Only 2 groups are pre-tested. 1 pre-tested group and 1 unprotested group receive the treatment. All 4 groups will receive the post-test. The effects of the dependent variable originally observed are then compared to the effects of the independent variable on the dependent variable as seen in the post-test results. This method is really a combination of the previous 2 methods and is used to eliminate potential sources of error. There are a variety of types of quasi-experimental designs. One is time series design, equivalent time series samples, equivalent samples materials design, non-equivalent control group, counterbalance designs, separate sample pre-test / post-test, separate sample pre-test / post-test control group, multiple time series design, institutional cycle design, and regression discontinuity design. This slide, we are going to go over reasons why you might use quasi-experimental design. It is most useful in situations where it would be unethical or impractical to run a true experiment. Quasi-experiments have lower internal validity than true experiments, but they often have higher external validity as they can use real-world interventions instead of artificial laboratory settings. So now we're going to dig a little bit into the definition of the two. So internal validity is the extent to which a study establishes a trustworthy cause and effect relationship between a treatment and an outcome. Internal validity also reflects that a given study makes it possible to eliminate alternative explanations for a finding. External validity. External validity refers to how well the outcome of a study can be expected to apply to other settings. In other words, this type of validity refers to how generalizable the findings are. For instance, do the findings apply to other people, settings, situations, and time periods? So those are all questions we really do want to ask ourselves when it comes to external validity. We are going to go ahead and go over a few examples of validity. So an example of a study with good internal validity would be if a researcher hypothesizes that using a particular mindfulness app will reduce negative mood. To test this hypothesis, the researcher randomly assigns a sample of participants to one of 2 groups: those who will use the app over a defined period and those who engage in a controlled task. Another example would be the researcher ensures that there is no systematic bias in how participants are assigned to the groups and also blinds his research assistants to the groups the students are in during experimentation. Another example would be a strict study protocol is used that outlines the procedures of the study. Potential co-founding variables are measured along with mood, such as the participant's socioeconomic status, gender, age, among other factors. If participants drop out of the study, their characteristics are examined to make sure there's no systematic bias in terms of who stays in the study. And lastly, an example of a study with good external validity would be in the above example. So the researcher also ensured that the study had external validity by having participants use the app at home rather than in the laboratory. The researcher clearly defines the population of interest and choosing a representative sample, and he or she replicates the study for different technological devices. So we are going to go over some internal and external validity key differences. The essential difference between internal and external validity is that internal validity refers to the structure of a study and its variables, while external validity relates to how universal the results are. To dig a little bit deeper into the both and the key differences, I'm going to go ahead and touch on those key differences. We'll start with the internal validity. So with internal validity, conclusions are warranted, controls extraneous variables, it eliminates alternative explanations, and also focuses on accuracy and strong research methods. Now, when it comes to external validity, findings can be generalized, outcomes apply to practical situations, the results apply to the world at large, and results can be translated into another context. So we are going to dig into the advantages and disadvantages of quasi-experiment. So we'll start with the advantages, and quasi-experiment has a higher external validity than most true experiments because they often involve real-world interventions instead of artificial laboratory settings, which we did discuss earlier in our presentation. Also, quasi-experiment has a higher internal validity than other non-experimental types of research because they allow you to better control for confounding variables than other types of studies do. Lastly, quasi-experimental designs are more frequently used because they are more practical and feasible to conduct research studies. On the other hand, there are some disadvantages when it comes to the quasi-experimental designs. So it does have a lower internal validity than true experiments. So without randomization, it can be difficult to verify that all confounding variables have been accounted for. The use of retrospective data that has already been collected for other purposes can be inaccurate, incomplete, or difficult to access. Also, statistical analysis can be difficult. And lastly, cause and effect cannot be determined as easily as experimental designs.
Differences between quasi-experiments and true experiments. There are several common differences between true and quasi-experiment designs. In a true experiment, participants are randomly assigned to either the treatment or the control group, whereas they are not assigned randomly in a quasi-experiment. Control over treatment. In the true experimental design, the researcher usually designs the treatment and decides which subjects receive it. In a quasi-experiment, the researcher often does not have control over the treatment, but instead studies pre-existing groups that received different treatments after the fact. Use of control groups. In the true experiment, it requires the use of control in treatment groups, and in the quasi-experiment, control groups are not required, although they are commonly used. So we're going to look at an example for true experimental design. Let's say you are interested in the impact of a new psychological therapy on patients with depression. To run a true experiment, you randomly assign half of the patients in a mental health clinic to receive the new treatment. The other half, the control group, received the standard course of treatment for depression. Every few months, patients will fill out a sheet describing their symptoms to see if the new treatment produces significant better or worse effects than the standard one. However, for ethical reasons, the directors of the mental health clinic may not give you permission to randomly assign their patients to treatments. In this case, you cannot run a true experiment. Instead, you can use a quasi-experimental design.